You missed your period, but is it stress or something life-changing? In the next few minutes, will reveal the subtle signs your body shows in the earliest days of pregnancy, signs most women overlook. If you've ever wondered, am I pregnant? Before even taking a test, stay tuned because what you'll learn today could change your life. Pregnancy is one of the most exciting and sometimes nerve-wracking moments in a woman's life. From the moment conception happens, your body begins a remarkable transformation. But here's the thing, not all pregnancy symptoms are obvious, especially in the first week or two. Some are so subtle that women confuse them with regular hormonal changes or PMS. In this video, we'll explore signs of pregnancy you can notice before even taking a test, discuss very early signs of pregnancy at 1 week, and help you understand the differences between implantation bleeding versus a period. We'll also talk about rare but important complications like placental abruption symptoms and miscarriage symptoms so you know when to get medical help. Chapter 1. The first hints before you miss a period. Implantation bleeding. One of the earliest clues is implantation bleeding, which happens when the fertilized egg attaches to the uterine lining. This typically occurs 6 to 12 days after ovulation. Color and flow, often light pink or brown, and much lighter than a normal period. Duration, 1 to 3 days. Cramps, mild or none at all. Unlike menstrual bleeding, implantation bleeding doesn't increase in flow and is often paired with other early symptoms like fatigue or breast tenderness. Breast changes, your body's estrogen and progesterone levels rise quickly after conception. These hormones prepare your breasts for milk production, causing tenderness or swelling, tingling sensations, darkening of the areolas, more visible veins under the skin. Fatigue, high progesterone levels can make you feel unusually tired, even if you're getting enough rest. Your body is already working overtime to support early pregnancy, increasing blood production and metabolic activity. Heightened sense of smell and taste changes. Some women develop a stronger sense of smell almost immediately. Foods or scents you once loved might suddenly seem overpowering, while you might crave things you normally wouldn't touch. Chapter 2. The big signal. Misperiod. A misperiod is one of the most well-known signs of pregnancy. But cycles can also be late because of stress, illness, changes in weight, or hormonal fluctuations. The difference is that with pregnancy, a misperiod often comes with other early changes like mild nausea, breast tenderness, or fatigue. Chapter 3. Pregnancy symptoms week by week, first trimester, week 1 to 2. Technically, pregnancy counting starts before conception from the first day of your last menstrual period. At this stage, your body is preparing for ovulation and possible fertilization. Week 3, fertilization occurs. Some women notice mild cramping or very light spotting, possible implantation bleeding. Week 4, this is when a misperiod may happen. You might feel subtle normal pregnancy symptoms such as mood swings, tender breasts, or slight fatigue. Week 5, the embryo is now producing HCG, the hormone that pregnancy tests detect. Many women start experiencing morning sickness, which can actually happen at any time of the day. Week 6, nausea and vomiting may become more pronounced. You might also feel more tired than usual. Frequent urination begins as your kidneys process more fluid. Week 7, food cravings or aversions often show up now. You might notice bloating due to increased progesterone levels. Week 8, your uterus is expanding and hormonal changes can cause constipation and heartburn. Week 9 to 10, fatigue remains high. Breast tenderness may increase and emotional ups and downs are common. Week 11 to 12, some symptoms like nausea may begin to ease, but for some, they continue into the second trimester. Chapter 4, implantation bleeding versus period. How to tell the difference. Many women ask, how do I know if it's implantation bleeding or my period? Here are the main differences. Timing. Implantation bleeding usually happens about a week before your expected period. Color, pink or brown versus bright red. Symptoms, often paired with mild cramping, not the heavier cramps of menstruation. Chapter 5. When to watch for warning signs, placental abruption symptoms. Although rare in early pregnancy, placental abruption is a serious complication where the placenta detaches from the uterus before delivery. Signs of placental abruption include sudden vaginal bleeding, sharp abdominal pain, uterine tenderness. This is a medical emergency. Immediate care is essential. Miscarriage symptoms. Unfortunately, not every pregnancy continues to term. Miscarriage symptoms can include heavy vaginal bleeding with clots, severe cramps or lower back pain, passing tissue from the vagina, a sudden stop in symptoms like nausea or breast tenderness. If you notice these, contact your healthcare provider immediately. Chapter 6. Myths versus facts about early pregnancy symptoms. Myth: morning sickness only happens in the morning. Fact: it can happen at any time of day. Myth: every woman gets implantation bleeding. Fact: only about 1/3 of women experience it. Myth: a missed period is the only sure sign. Fact: hormonal changes can trigger subtle symptoms before you ever miss a period. Chapter 7. How to confirm pregnancy naturally, while home pregnancy tests are the fastest method. You can also track basal body temperature, remains elevated after ovulation if pregnant. Watch cervical mucus changes, often thicker and creamier. Note early changes like bloating, fatigue, or breast tenderness. Still, blood tests and ultrasounds remain the gold standard for confirmation. Chapter 8. Caring for yourself in early pregnancy. If you suspect you're pregnant, start taking prenatal vitamins with folic acid. Avoid alcohol, smoking, and certain medications. Eat a balanced diet and drink plenty of water. Schedule a prenatal appointment early. Conclusion. Recognizing the earliest signs of pregnancy can help you take steps to protect your health and your baby. Whether it's very early signs of pregnancy, 1 week like implantation bleeding, or more common normal pregnancy symptoms such as fatigue and breast tenderness, each signal is your body's way of preparing for something extraordinary. At the same time, knowing when symptoms like vaginal bleeding, abdominal pain, or uterine tenderness could indicate placental abruption symptoms or miscarriage symptoms is just as important. Every pregnancy is unique, but your awareness could make all the difference.